Hello and welcome everyone
Hi guys.
to my YouTube channel.
Yeah.
So I am Dr. Saroj and with me I have my beautiful wife, Dr.
We're
Pinku.
really saying this.
Yeah. So today is the last day of her internship and I really wanted to know her experience and record it and let you guys know how was her internship experience and what she thinks could have been done better, so that if any prospective intern is watching this video, they can make the most of their internship. So I would like to welcome you on this YouTube channel. How are you feeling?
Thank you. I'm feeling good. Good because also it's the end of my internship, and also I'm excited to answer some of your questions. But I don't think I might be might not remember all the questions because we are doing it without any preparation. So yeah, let's see how
I
it
think
goes.
it is a very raw video,
Yeah.
and so we are very excited about it. So how was your overall experience of internship? How would you like to remember your internship as?
So my overall experience was good, like really good. I had a mixture of experiences. I would rate that from good to bad, but overall I would like to call it good. And I got to learn a lot of things, and also the practical stuffs, the aspects of becoming a doctor in Nepal, and also about my vision of what would I like to do in my professional life ahead. So yeah, it was a good experience overall.
Okay, so very good to know that you enjoyed your internship, right?
Yeah, I really enjoyed my internship as well.
Okay. So if I have to ask you, like, you must have thought something about, how your internship would go like. Was there any difference between your expectations and how you really felt during your internship?
Yeah, there was. So first of all, what I thought of internship was like there is always going to be this fun thing. There's always going to be this interesting day where I'll be going to the hospital, looking at the cases, and doing some practical stuff, learning as well, and along with that, have some fun with my friends as well. And overall, it was a mixture of everything. But I think there was, apart from this, there were a lot of paperwork to do, and also somewhere in between it was not like what I expected. So there were phases like that as well, and there were also phases where I thought that wow, this was new. I didn't expect this to happen. So it depends. Yeah, it depends from the department in which I was rotating, and that makes a big difference, I guess.
Okay. So which department did you enjoy the most?
There are multiple departments which I enjoyed my internship, and ER was one of them. I really liked working in the emergency department because I felt like I would be doing this after the end of my internship. So, and it was interesting to look at the cases from the first to the management aspect. We were one of the first hands people to work on the case and see.
So in the internship, emergency medicine is really very satisfying to work in, because you get to treat the patient immediately and you can see the immediate relief in the patient. So I think that is the most satisfying part. Yeah. So apart from emergency medicine, which department did you like the most?
I really enjoyed working the surgery as well. I like to do the procedures, and first of all, it was I was also anxious about doing the procedures. First of all, I learned from my seniors, and they also taught us in a good way. And going to the OT was fun as well. And apart from surgery, I really enjoyed anesthesiology as well, because I got to do the intubation and give the spinal anesthesia. So there were some hands-on experience that I got to do, and I really enjoyed the departments where we were exposed to practical knowledge and we got to do stuffs on our own as well. Oh yeah, I should not forget Gynae ops as well, because that was the first department I got to rotate. Okay. And the first few days of internship, where you had this enthusiasm and a lot of zeal to work. Yeah. So Gynae was one of those department for me, where I really made the most of my gynae obs posting.
Wow, so it's
So,
good to know that you had, you enjoyed most of your days. I think it was less of a work and more of a fun.
yeah, gynae was really fun because I had this energy in me to do all those stuff, and it was also the first department, so me along with my friends, we made the most of it.
Okay, so I will share my experience of being an intern in surgery and gynae ops. I used to think that in the surgery it's all about doing the surgery, but as a famous person has told, being the best surgeon, you should know when
Not to do the
cut
surgery,
it open.
yeah.
Yeah. So and the most exciting part for me in the surgery was obviously in the OT. And initially I was very anxious. I didn't know what to do and how to do, but in the junior intern, I had practiced tying a knot and suture. So I think that was the most exciting part. Now it seems as if it's really easy job, but at that time, putting the first suture and in a real patient, it was really exciting. And I think that is the most exciting part. And whenever you think of a surgeon, you think just cutting things up, suturing it up, suturing it, and then things like that. I think my surgery internship was, I think it was fun. However, it was a bit hectic. It was hectic because I was really interested, and I used to go and get involved in all of the OTs that were available during my schedule. So it was hectic in that way. Otherwise, it was a very learning experience because our professors used to, teach us during the OT time, and they used to ask us questions. Most of the time, I was void of the answers. I didn't know. Then they used to tell them, okay, so this is this organ. Do you want to touch it?
Wow.
And when I was in scrub, I really felt good while touching the internal organs. Otherwise, most of the time being an intern, you're just suturing the skin. You don't get inside the body really. So that was a good experience in a surgery. And talking about the gynae ops, so I was not that interested in gynae and obstetrics because I was really afraid of the babies, and I didn't know how to deliver the baby, and I think I was scared because I didn't know what if something was wrong. But there were nurses, residents, and our faculty members who used to be on my back. Yeah, so it was a good experience. But I think if I have to choose between gynae ops and surgery, I think surgery was really fun, and in gynae ops, it was kind of honestly speaking, I didn't like that much because I didn't thought that I would be pursuing this specialty in the future. So I think I didn't like it because I didn't give my 100%. So yeah. So okay. So now going back to yours.
Yeah, sure.
So which was the most hectic department to work with?
The most hectic department in my view, medicine, I guess. Because it's lengthy. It has a lengthy duration of internship. I think it has 3 months of internship, which has other departments in it as well. But I think medicine was the hectic one with longer rounds and lots of patients, and we had to write notes and discharges, every single thing. In medicine specifically, so we had this 15 days rotation of chest medicine, and I think chest medicine was the most hectic one among the all medicine units because there were lots of patients admitted, and with that comes taking care of lots of patients, and learning along with that the paperwork comes as well, because that's so common in our part of work. Everything has to be recorded, has to be documented, which is a good idea, but it also comes with lots of responsibilities to maintain the records. So yeah, I think chest medicine was the most hectic one.
Okay, so I'll tell you from my experience. I really enjoyed being an intern in internal medicine department, and it was because every patient was very unique. I know patients are unique in all of the departments, but I'm telling it particularly in internal medicine because the patient really had diverse symptoms. I mean, sometimes it was very difficult to correlate and I think that difficulty was very intellectually stimulating as well.
That's true.
So being in the round was the best part. And I can understand why you think internal medicine was hectic for you, because in our part of the world, interns and even the resident doctors are, responsible in doing all the clerical works, drawing blood. This doesn't happen in other countries. I mean, in the Western world. So that is the main part why interns find internal medicine to be hectic. Otherwise, I think it is a really interesting one, and because you get to see the patients of all varieties, and I think internal medicine prepares you for all the specialities, because you learn how to connect dots and make it a story, and then when you listen to symptoms in you, and sometimes you would not know at the start so what you are dealing with, but once you talk with patients, review their history, spend time with them, when you have questions, you share it with your residents, with your seniors, with your attendings, and then they give you a perspective, and then they ask you to search more about it, and then you start searching in the literature, so what would it be. And I think if you have a very curious perspective, then you would find internal medicine a good fit for you. But I think these clerical works, overload of patients, and that might be the reason what makes internal medicine hectic. But I really enjoyed the internal medicine portion. I'm so sorry to hear that you didn't that was very hectic for you.
Yeah, it was hectic, but not interesting.
Okay, I get you.
Yeah, internal medicine also teaches to come to the provisional diagnosis with going through the investigations, going through the patient's records, going through the symptoms daily, monitoring and everything else. It is interesting, but it was hectic for me in the sense that I remember there was a day particularly where I had gone to my college for the BLS ACLS training. I had to come back to the hospital and prepare like 10 discharges in the span of 2 hours, and we really have this lengthy record system.
Wow.
So that was like one of those days, and I remember most of the days being such. So it was hectic in a way that
Okay.
just used to get tired, but it was not boring, I would say.
Okay. So there might have been days where you felt where you must have felt very low during the internship.
Yeah, I did.
So what were those moments?
So there were lots of such moments as well. Especially the burnout sometimes, and also it was a new experience because I couldn't sacrifice my sleep prior to internship, and there are also situations where we had to wake up in the middle of night. We went to sleep at around like 10 or 11 p.m. and again wake up at night, deliver a baby, and go into the CS. And Gynae I was posting had loads of such days where I had to wake up during night and go for emergency cases, and also in other departments as well. So that was one of the challenging aspect for me, because I had no such experience of sacrificing my sleep prior.
Okay.
That was one of the points. And apart from that, there were days when I used to be alone in a posting. For example, in gastromedicine, I was a single intern for about 2 to 3 days, and there were numerous incidents as such. For example, in psychiatry, I was alone in the department for like 2 days among the interns. So obviously, when there are less people, the workload gets higher, and it becomes a factor for burnout. And those were some of the aspects where I was having lowest point. And there were also days where we had to sacrifice coming to home for some ceremonies or family functions, and where used to get busy in rounds or stuff like that. We had night duties on several functions, so those are some of the things that we had to cope up with and learn, because this is our profession and it's just the beginning of the profession. And
I can totally understand.
Situations like this will obviously come in the future. So
I can totally understand, and I think you need to understand these things, that these sacrifices are doing it. They prepare you for the worst. And I think you have chosen to be a doctor.
Exactly.
And I think therefore it's easier for you, and it's easier for us to cope up in those situations. We are prepared for it, although we don't like it for a moment, but we are up for it. We have chosen this path by ourselves.
Yeah.
So I think that validates all the low moments.
Exactly. And I will also remember some of the situations in life where patients actually became friendly to me and thanked me for some of the things that I did. And it really, like, I cannot forget those moments in my life as well. Those little moments give me inspiration to, carry it on further. So, yeah.
Okay, so some of the prospective interns might be watching our video. So what advices do you have for them?
My advice for the internship is that be prepared for like any situation. It could be expectations versus reality as well, and it could be much more than that. Like you expected less, but you got to learn more. Because those stuffs happened to me in some of the postings where I really enjoyed interacting with patients and learning through their condition about the disease. And apart from that, it's not just only the clinical condition that we are treating or we are getting to learn. It's also the emotional aspect. Every patient is a person. It's not just the clinical case or the condition we are dealing with. We are dealing with a complete human being. So there were several points in my internship where there were these emotional aspects which were much more higher compared to the clinical condition. Talking to the patients, their relatives, they obviously have some expectations with us, and we get to talk to them on a daily basis, and we also have to look onto that aspect as well. So just be kind to everyone, and see, you learn during internship. And okay, so sometimes you also might want to bunk, or the other things waiting for you which are much more important. You can do that as well, but you need to have a good team, you need to have good friends, and you also have to sacrifice so that your friends can get time as well. So you also learn the team dynamics and time management and lots of things during internship. It's not just about the MBBS aspect. It's lots of things. And also, don't forget to have fun, because
because that time would never return, no?
It will never return. And apart from being a doctor or a medical student, we are human beings as well. So so we also need to have fun. We also need to enjoy whatever we do.
I think you should be in best of your mental state if you want to take care of others. Otherwise, you can't. That's really, if you are not mentally free, if you are not feeling fresh, even if you try to do the best of your patients, it's not going to work. I think that I've learned from my experience. If you are a prospective intern who is going to join the internship, I would say the most important thing for you would be, be open to feedbacks. I think that's the most important thing. If you are open to feedbacks, you will really improve on yourself. Sometimes you may feel confident in doing things, and you finally mess up those. So I think you need to have an open mind for feedbacks. And second thing would be punctuality. Be punctual. You would feel as if it doesn't matter, but it matters in the long run, because internship is a time period where you get trained for the future.
Also, that you build your habits, your professional habits. It's just the beginning of your life, the professional life, and habits are what. And
apart from being punctual and being open to feedbacks, I think the third most important thing during internship, so it is the phase of life where you have to decide what do you want to do in the future, and which specialty you are going to pursue. And here is the commonest mistake that we make. So before internship, we are not exposed to the reality of different specialties. And this is the time period where you get to know what are the pros and cons of each specialty. But if you already make your mind that I am going for surgery, so I will give my 100% in the surgery department, and I'm not pursuing gynae ops, so I won't be giving 100% in gynae ops, then I think this is the biggest mistake that you will make in your life. You might be motivated, but I think internship is the last time where you get to explore all of the specialities. So you should give your 100% in all the departments. Try exploring all the opportunities that you have in each of the specialties, so that you make an informed decision about yourself. And I think in the internship you really get to know the you really need get time to explore your interests in other specialties as well. And sometime in your life, these experiences will help you. You never know, you have to deliver babies on your home, and being a doctor and not learning how to do it in the internship is really something very scary in real life. So be prepared to explore your interest in all of the specialties, and being interested in one specialty does not mean you have to be disinterested in another specialty. You need to learn about all of the things, and then make informed decision about your career. So
I'd like to add one
Sure,
more thing.
sure.
So what you can do is that you should also learn how to bond with your colleagues,
Yeah.
your residents, your consultants, because now onwards you obviously you're going to meet some of those people in your life, and maybe you also work with them in your life ahead. So it's a nice time to get bonded to some residents, consultants, and your colleagues as well, because that is going to make an impact in your life ahead.
Yeah, I think you make best of the your friends in this journey.
Yeah, that's true.
Yeah. So do you want to share anything else,
I think that
or
was...
you have saved those things for the next video?
Maybe we can make a part 2 on this.
Okay, so this video has already got very long, and let us know if you want to know anything more about internship, about MBBS in general, about how to decide on the specialities, how to prepare for postgraduate entrance, be it of Nepal or somewhere else, maybe USMLE or a PLAB. Will get back to you on my channel and maybe on hers as well.
And also feel free to give us any suggestions or feedbacks so that we can improve ourselves in the videos to come.
Okay, thank you guys. See you.